This medication guide is to teach you about common over-the-counter and prescription medications that are used following abdominoplasty or circumferential abdominoplasty like belt lipectomy or body lift surgery. First, I want to cover the things you should stop prior to surgery. These would include over-the-counter blood thinners and herbal supplements. We recommend you stop these 2 weeks prior to surgery, and common over-the-counter blood thinners include aspirin, ibuprofen, and fish oils. Now, this is really important. If you're on birth control pills, that can greatly increase your risk of a deep venous thrombosis or DVT. We want you to stop these a full month prior to your surgery and be sure to use a reliable alternative form of birth control. Once you've healed up from surgery and your activity levels are more normal, maybe 2 to 3 weeks, you can resume your birth control pills. But it's important to remember that if you are in the mood for having sex right after an abdominoplasty, which I don't think would be that common, be sure to use an alternative form of birth control until you've been back on your birth control pills for a full month. If you're just on hormone patches, estrogen hormone patches for postmenopausal symptoms, take these off the day or night before surgery, and you can resume these again when your activities are more normal. There are several over-the-counter medications that are smart to have in your house when you're healing from surgery. The first is Tylenol, which is very important in helping to treat pain. There are common over-the-counter anti-nausea medications that can also be helpful, like Dramamine, which does tend to make you drowsy, or Bonine, which has less of a drowsy side effect. It's also not uncommon to get a little indigestion or acid reflux, so having Tums or Pepcid or any other of the over-the-counter antacids can also help to reduce those symptoms. Having a little itchiness after surgery is really common, and this can be treated with over-the-counter antihistamines like Zyrtec and Claritin, which have less drowsiness, and Benadryl, which can actually be used to help you get a better night's sleep. Tylenol or Acetaminophen can be extremely helpful in reducing postoperative pain with minimal side effects. It's important to know that Tylenol comes in 2 strengths, regular and extra strength, and we recommend using the extra strength, which is 500 milligrams per pill. We recommend patients take 2 of these extra strength Tylenol 3 times a day, round the clock. This is a total of 1,000 milligrams per dose or 3,000 milligrams in a 24-hour period. Tylenol can be dangerous if you take more than the maximum dose, which is 4,000 milligrams or 8 pills in a 24-hour period. So taking 2 of them 3 times a day or 6 pills a day stays well below that maximum dose. Unfortunately, getting constipated is really common after an abdominoplasty. So starting 2 weeks prior to surgery, we recommend you take a fiber supplement and a stool softener called Colace, which is taken twice a day, 2 weeks prior to your surgery. Also, the morning of your surgery, we want to make sure you do an enema so that you are fully evacuated. After surgery, you'll go back on the fiber and the Colace, and if you haven't had a bowel movement on postoperative day number 4, we recommend you take a laxative. And there are plenty of different choices. Milk of magnesia works well. You can use a Dulcolax suppository. There are some specialty herb teas that help you move your bowels, and you can even do another enema if you aren't successful. Arnika Forte is a homeopathic medication that we'll give you at your pre-op, and this is intended to speed healing while reducing swelling and bruising. It's important to note that it does contain pineapple and papaya, so if you have allergies to these foods, it's best for you to just skip it. This is a medication that's typically started the night before surgery and can be continued twice daily until gone. We will give you several prescription medications, and they will be transmitted electronically to your pharmacy the night of your pre-op appointment. One is an anti-inflammatory that helps reduce pain. Also a muscle relaxant, which is super helpful once we've tightened those muscles in your belly, a narcotic pain medication, something for nausea, and also a blood thinner shot to help reduce the risk of deep venous thrombosis or blood clots in your legs. Celebrex, or the generic Celecoxib, is the optional anti-inflammatory that we recommend using to help reduce pain after surgery. I like to describe this as designer ibuprofen because each one of these capsules will last for an entire 24 hours. It also has significantly less bleeding problems than the other non-steroidals, and this is something that can be taken as needed to help treat your pain. The dose is based typically on your age and your kidney function. So if you don't have great kidneys, you may want to skip this one altogether. If you're under the age of 65, you can take up to 2 of these in a 24-hour period. If you're over 65, we like to only allow 1 capsule every 24 hours. This is typically started the morning of your surgery in the hospital with a tiny sip of water. If you're under 65, you can resume it the evening of your surgery, and if you're 65 or older, you want to resume it the following day. Valium, or the generic Diazepam, is a pretty powerful muscle relaxant, and by relaxing muscles around the surgical site, this can help to reduce pain. It's also a good anti-anxiety medication, and this can just serve to make you a little more comfortable while you're healing from surgery. You can take 1 5-milligram tablet every 6 hours as needed. Because this is sedating, you want to stagger it with your pain medication. You don't want to take them at exactly the same time, and it's safest to allow 1 to 2 hours between them before you take an additional medication. Do not take the Valium if you're already on sleeping pills like Ambien. It's probably better for you to skip the Ambien and use the Diazepam in the early healing phase than if you want to go back to your sleeping pills later when you're off your prescription pain medication and muscle relaxant, you can. Also, if you're already taking other anti-anxiety medications like Xanax or Ativan, you absolutely do not want to take those at the same time. Those are better for the anxiety, but less good for muscle relaxants. So many patients will just switch to the Diazepam until their pain is really resolving after surgery and then go back to their other medications. Now, THC is also something that's important. I think if you regularly use THC, it's a good idea to avoid it until you're off your prescription pain medications. Now, this is generally a medication that we don't like to refill, so make sure you make it last and take it responsibly. We will also prescribe a narcotic pain medication, and these are typically from the opioid family. Many people want to avoid taking these altogether, and that's totally fine. If you don't need it, don't take it. The medication we prescribe is oxycodone, 5 milligrams, and you can take 1 of these every 4 hours as needed. If your pain is more severe for a period of time, it's safe for you to take 2 of these every 4 hours, but we don't want you to stay on that dose for any prolonged period. Now, these pain medications are very sedating, so you would never take your Valium at the same time as the oxycodone. You want to stagger them. Is it more that you can't get comfortable and your muscles feel really tight? Valium may be a better choice. If it's incisional pain or just pain in general, the oxycodone may be a better choice for you. So try to leave at least an hour or 2 between these different medications to see if you really need the second dose. We do have other options. We have Ultram or Tramadol, which is a non-narcotic and typically not as strong as the oxycodone. It can be taken on the same schedule as 1 every 4 hours as needed. There's also a stronger option called Dilaudid, and most of the surgeries we do don't really require this strong of pain control. It can also be taken on the same schedule because it does not have Tylenol in it, just like the others we've discussed. Some people prefer a medication called Norco, but we like to avoid this one because Norco has Tylenol in it, and it kind of screws up that baseline of taking Tylenol round the clock to help deal with your pain. This is a really important point I want you to remember. It's the patient, not the caregiver, who should decide if and when this medication is needed. Your caretaker can stop you from taking too much, but they shouldn't decide when it's time for your next dose. We have goals of pain control, and most importantly, the goal is not to be completely pain-free. You need enough medication that you can get up and walk around and breathe deeply. Also, it's difficult to sleep when you're sore, so most people will take this at night, but kind of suffer through it during the day. The faster you can get off this medication, the better, because it does have a lot of side effects. The most common is nausea. So when you are taking your oxycodone, be sure there's a little bit of food in your stomach before you take a pill, and that should be helpful with the nausea. It also causes oversedation, which we already talked about. So make sure you're staggering it with other sedating medications. It can also cause itchiness. So you have your antihistamines if you are experiencing itchiness after taking this medication. Constipation is a big one. You may want to use a laxative or stool softener because taking narcotics can lead to more prolonged constipation. We already know about the problems with abuse and addiction of this medication, so it's a good idea to use it only if you need it and stop it when it's no longer necessary. We also want to make sure you're well armed to treat nausea, so we will prescribe a medication called Zofran ODT. The generic term is ondansetron. With this little tablet, you just place it under your tongue, and that's how it melts and absorbs. This can be used every 4 hours as needed and has minimal side effects. In pre-op, they may also place what looks like a little spot Band-Aid either behind your ear if you're having surgery on your breast or body, or on your arm under a little piece of sticky saran wrap called Tegaderm if we're working on your face. Now, this will actually help with nausea for 3 full days. It does have some side effects. Dry mouth is the most common. It can also cause blurry vision, urine retention, so we typically skip this in males, and it can cause some confusion in older patients. So if you're 65 or older, we will just skip it. Now, when you take this off your skin, which you can do at any time, you want to be sure to wash that area with a washcloth and soap and water. Also, wash your hands after handling that little round disc. Take that washcloth and throw it in your laundry. Don't reuse it. If you're still having nausea, remember the over-the-counter medications, Dramamine, which makes you a little drowsy, and Bonine. Those can also be used with the Zofran if you're not getting relief from your nausea. Lovenox is a blood thinner medication that's used following surgeries like an abdominoplasty that have a higher risk of deep venous thrombosis or blood clots. Now, it's not necessary for every patient, but we use it to help reduce the risk of any complication. It's a subcutaneous injection that started typically the day after surgery once we know there haven't been any signs of excessive bleeding. It's given every 24 hours. You never want to give this medication early. And it's continued until you feel like your activities are more normalized and you're really up moving around a lot after surgery, typically at or before 10 days. Now, it's not required in all patients, but it's better to avoid that blood clot risk in as many ways as possible. Lovenox can be given in a variety of different body areas. The easiest is probably the side or the back of your upper arm. It's also easy to give this shot yourself in the front of your thigh. If you watch teaching videos, they're typically going to tell you to put it in your abdomen, where you can if that's your only option, but just since we just did surgery there, to me it seems like probably not the best choice. Lovenox is intended to be a subcutaneous injection, which means it's under the skin but above the underlying muscle layer. You can find this easily by giving your skin a little pinch and lifting it up, but not getting a big handful where you feel like you're getting the thicker tissue underneath. You can also angle the needle as it goes in so you don't go too deep. We do not routinely prescribe antibiotics following this surgery unless perhaps there's a special situation like the patient is immunocompromised. Well, congratulations. You now understand the medications used both before and following your abdominoplasty surgery. I think it's important to watch this video before your pre-op appointment and then also after you've picked up your prescriptions and you have them sitting in front of you. Likely somebody is going to help take care of you after surgery, and I think it's super important that they watch this video too so that they understand what all of the medications are used for and how best to help you.